In the 1970s, the rates of cervical cancer were almost 15 per 100,000 women, and we've gotten that rate down to less than 7 per 100,000 women. But to keep the rates low, we need to keep women on top of these preventative screenings. There are very few symptoms to cervical cancer, and they only usually occur in late-stage disease. So early-stage disease or precancerous lesion generally does not have really any symptoms. Later in the disease, you may have irregular bleeding, abnormal discharge, pelvic pain. Any of those symptoms are reasons to see your gynecologist. They will most likely lead to a benign diagnosis, but they're things that shouldn't be ignored, especially if you haven't had a preventative screening in some time. There's two components to our screening methods that we have now, and the pap-smear is the main component still. So the two parts are cytology, meaning that we take a sample of cells from the cervix and those go off to the lab, and the pathologist actually looks at the cells to see if they look normal, if there's any abnormality to them. The second component is done based on your age or if there are abnormal cells seen, and that's the HPV test. The guidelines for screening depend on a person's age. So between the ages, we start screening at age 21. And so between 21 and 30, we do cytology only, and generally don't check for HPV, because in that age category, the virus is almost entirely transient. Or younger people, their bodies are very good at clearing the virus, and it's less likely to be a persistent infection at that point. So in that age category, we screen every 3 years with cytology only. After the age of 30, as long as they've had normal pap smears in the past, then you can either continue with every 3 years cytology only, or combine the cytology with the HPV screening, and as long as they continue to be normal, every 5 years. If your pap comes back abnormal, there are several different categories that it can be in. There's small or mild changes up to more severe changes, and those are handled slightly differently, and also depending on if you tested positive for a high-risk type of HPV or not. In many cases, the pap will just need to be repeated a little bit earlier than the recommended 3 to 5 years, or for some types of changes, or if there was a high-risk HPV positive test as well, then we'll go to a biopsy. That test is called a colposcopy, so it's performed in the office. No anesthesia is needed or anything like that. So we visualize the cervix, put on a stain that shows us the abnormal cells, and we take a biopsy of that specific part, and again, that goes to the pathology department for analysis. And then they give us, it's just a bigger tissue sample, and they can give us a more definitive diagnosis from that. If there are some more significant changes, we've still prevented a cancer by watching it closely, and there are procedures we can do to either freeze a portion of the cervix or excise it, and those are both surgeries, sometimes done in the office or sometimes done in the operating room. But we can take out that portion of abnormal tissue, and we watch again with pap smears after that, and often it's curative. It's very important to stay on top of any preventative health, and pap smear is no different. Even though pap smear is not necessarily recommended every year, screening, like I said, by age category 3 to 5 years, we do recommend a pelvic exam every year. And depending on your age, STD screening is important as well. I really want to encourage everyone to just stay on top of preventative health in general, including your pap smears or whatever screening is recommended for your age group. And if you have any questions, certainly ask your doctor.